Sorry for some technical glitch. Now, I'll be talking about diet in irritable bowel syndrome and liver disease. And as we all know, that we, the physician, give a lot of importance to, to the drugs. But the diet is equally important for care of patients. This, most of the time, people forget. So, I'll be talking about diet in irritable bowel syndrome and liver disease. I thank Dr. Anita Saxena for giving me this opportunity. Now, I'll start with a story of a patient. This is a 26-year-old lady who is. Can you see my slides now?
Yes, sir. Yes, sir. Yes, sir.
Yeah. So when we inquired more from her, we realized her symptoms were more when she was visiting her home place, which is at Lucknow. But she was feeling better when she was in Hyderabad. Now, one would say, why should it happen? Could it be related to the stress and anxiety? Because we all know irritable bowel syndrome also get exacerbated when somebody become tense and anxious. But what happens is this is not the likely explanation. The reason for that is always anybody would say that the anxiety and tension would be more at the medical college or institute where a healthcare worker is working than at home. Could it be related to the diet? Yes, that is the case because she used to like the roti and curd too much. And whenever she would visit home, her mother will give this in plenty. So this must be related to the diet. Now, what is irritable bowel syndrome? It is a chronic disease where somebody has abdominal pain and altered bowel habit, and there are no alarm feature. Now, our patient did not have any alarm feature, therefore, we diagnosed this to be irritable bowel syndrome. Now, further on, as I told you, that her symptoms were less when she was in Hyderabad, but these were more when she was in Lucknow. What could be the explanation, the variability of the symptom? I told you that this is not related to the anxiety and tension that she could be having, but this is related to the dietary variation as the northern Indian people like wheat-based diet and they take a lot of paneer, whereas in southern India, predominant diet is rice-based. Now, further course of this patient, let me tell you, we did a lactose hydrogen breath test, and that showed that she has biochemical evidence of lactose malabsorption. We did a fructose hydrogen breath test that revealed she has fructose malabsorption as well, and we know that the wheat contain a lot of fructose and fructans. Now, how do you do hydrogen breath test? Typically, what we do is that we actually take breath hydrogen in fasting state. We take breath hydrogen in fasting state. Subsequently, we feed the patient with lactose 25 gram mixed with about 200 ml water. Now, if somebody is lactose uh, tolerant, that means they can digest lactose, they can break the lactose into glucose and galactose. What would happen is there will be no increase in the breath hydrogen. But on the other hand, if somebody is a lactose malabsorber, meaning thereby there is low quantity or no lactase in their brush border of the intestine, the lactose will reach the cecum because it remains undigested in the small bowel, from where the bacteria of the large intestine will digest lactose, will produce gas such as hydrogen and methane, and these gases we measure with hydrogen and methane breath test. If there is an increase in the breath hydrogen following ingestion of the lactose, this is evidence of lactose malabsorption, and this is what our patient had. We also do a blood sugar in the fasting state and subsequently after half an hour after lactose load. Normally, if somebody can digest lactose, their blood sugar will rise by 30 milligram per deciliter at least. But somebody cannot digest lactose, what will happen is there will be no rise in the blood sugar, which suggests that he has lactose maldigestion. So our patient improved on withdrawal of milk and milk product, and also we told her that actually if she takes wheat and milk or milk product, obviously her symptoms are going to increase. So therefore she has to be making a choice between having the symptoms or avoiding the foods which she really likes. Hence, this actually helps the patient to be more compliant because you empower the patient with knowledge rather than giving a sort of advice like a parent, do this and do that, don't eat this or don't eat that. So therefore, what is functional GI disorder? People thought these patients have illness in their mind and there is nothing in the body or the intestinal tract, but this patient typically shows you that the her problem was really in the gut. So what is the diet advice that we typically give to IBS patient? We ask them to take small and more frequent meal. We ask them to reduce their fat content in the diet because fat delays intestinal transit time, which may result into further increase in the bloating. We ask them to avoid smoking, alcohol, caffeine, non-steroidal anti-inflammatory drugs, which damages the gut. We avoid them, avoid in their situation, avoid carbonated drink because carbonated drink produces a lot of gases. Avoid irritating food. That means whatever food irritates them. Like somebody may say, when I take a lot of onion, a lot of chapati, a lot of milk, I really feel like bad. So in those are the irritating food for that patient, and this food should be avoided. This is question that every patient asks. What food should I avoid? What food can I eat? Should I eat more fiber? Can I drink milk? How to reduce bloating? What causes gas? And let me tell you, this is a study that we did in our center where we found that though frequency of lactose malabsorption is very high, both among IBS patient and healthy people in northern India, but what happens is patients with IBS more often produce symptoms following lactose load, which suggests that they are unable to tolerate the gas that is produced following fermentation of this form of food. If you are in southern India or you are in northern India, you have a difference. Northern Indian people, though have high frequency of lactose intolerance to the tune of 50 to 60%, southern Indian people frequency of lactose malabsorption is much higher to the tune of 80%. Now, there is a terminology which is called non-severe gluten sensitivity. This is really a wrong terminology because these people do not have sensitivity of gluten, but they have sensitivity to the other content of the wheat, that is fructose and the fructan, and this is the study that shows that. This is the frequency of fructose malabsorption among our IBS patient. It is about 14%. And let me tell you, all these malabsorbed food, for example, complex carbohydrate, maybe lactose, maybe fructose, maybe fructan, they come to colon where bacteria ferments this food and that lead to production of a lot of gases. And these are the gases which produces problem in this patient. And now there are ample number of studies to show low ferment, low FODMAP food. FODMAP stand for fermentable oligo, di, monosaccharide, and polyol. So low FODMAP food are better food, healthy food to IBS patient. Now, these are the high FODMAP food. These include fructose, which is a fruit sugar, lactose, which is a milk sugar, fructan, which is a type of fiber present in wheat, onion, garlic, and chicory, and polyols such as sorbitol and mannitol. And if you want to know more what all diet are high FODMAP and which are low FODMAP, I'll request you to log on to www.spreadhealth.in, where we have put this chart which will help you to know which diet your IBS patient should not take or should take. And there are a lot of studies on this, but I will like you to read this study, which is the one of the first randomized controlled trial from Australia. Now, scientific evidence of FODMAP diet: 70% response rate to low FODMAP diet, 50% reduction in symptom, benefit in all four subtype of IBS. Control subject who do not have IBS, they are unaffected by low FODMAP food, and FODMAP diet implementation may be more difficult among vegetarian and among people in whom wheat is the staple food, such as in northern India. So I'll skip here, and then I'll skip to go to the dietary approach to the management of the liver disease. There are some inappropriate belief in relation to diet in patients with liver disease. Cirrhotic patients are often malnourished and they need a balanced diet with adequate protein and calorie. On the other hand, many physicians tend to stop a lot of their dietary ingredient, which is not a good thing to do. Overweight and obesity, on the other side, can lead to liver disease, such as non-alcoholic fatty liver disease, even cirrhosis of liver. Now, let me talk with you how common is malnutrition among patients with liver disease. This is a study from Dr. S.K. Sarin, which was published in American Journal of Gastroenterology, and he showed the malnutrition is very common among Indian patients of alcoholic and non-alcoholic liver disease. What are the diet to be avoided by cirrhotic patient? The protein which are from animal, they have typical tendency to produce more encephalopathy in patient with advanced liver disease. So therefore, the protein in this patient should be better, the protein from vegetables rather than animals. These are the food which the liver disease patient can eat adequately, but you restrict the water content in liver disease patient. And second is salt should be avoided in patient with ascites. Avoid alcohol, obviously it is needless to mention here. Branch chain amino acid are better than aromatic ones. In fact, many of these protein in the plant source, they have more branch chain amino acid. How much water and liquid to be taken? We all know cirrhotic patient with ascites, they have excess water in their tummy, and therefore you should reduce their water intake. And the water intake should be maybe 400 to 500 milliliter, less than the amount of urine output they produce in a day. Obese diabetic patient with NFLD should lose weight and control diabetes. This is very, very important. And the liver disease management, let me tell you, is a team approach. So I will stop here and take up any question that you